Welcome, and thank you for visiting the educational exhibit entitled Ulcerative Colitis, Today's Issues and Options, sponsored by Santaris Incorporated, a specialty biopharmaceutical company focused on acquiring, developing, and commercializing proprietary products that address the needs of patients treated by physician specialists. Ulcerative colitis is a chronic disorder characterized by diffuse inflammation of the colonic mucosa that usually begins in the rectum, extending proximally in a symmetrical, circumferential, and uninterrupted pattern to involve parts or all of the large intestine. The most common form of inflammatory bowel disease worldwide, ulcerative colitis, or UC, is considered a disorder of modern society, with the frequency of the disease on the rise in developed countries since the mid-20th century. While precise prevalence data for ulcerative colitis is limited due to lack of a gold standard criteria for diagnosis, inconsistent case ascertainment, and disease misclassification, it is thought that approximately 500,000 people suffer from this disease in the United States. Population data indicate that most patients will have mild to moderate disease. In 2003, an estimate of annual treatment expenses for the most common chronic conditions in the United States totaled $277 billion. UC is without a medical cure and will require a lifetime of care. While recent estimates of the true treatment costs don't exist, current studies have indicated that the burden of illness is substantial, with the loss of over 1 million workdays per year, and estimate that hospital costs are over $960 million, and drug costs may be as high as $680 million. From a practical standpoint, treatment will be based upon the endoscopic extent and the clinical severity of disease. This information may also help predict the patient's prognosis. In 2010, the American College of Gastroenterology's Practice Parameters Committee published an article entitled Ulcerative Colitis: Practice Guidelines in Adults. The document discusses the use of the Truelove-Witz criteria to characterize disease severity as mild, moderate, severe, or fulminant, as this graphic illustrates. However, the authors note that more recent clinical trials, particularly with ambulatory patients, have used a composite scoring method based on the number of loose or soft stools, frequency of rectal bleeding, sigmoidoscopic appearance, and physician assessment. These scores are referred to as the Mayo Clinic Index, Sutherland Index, or the UC Disease Activity Index. While a step toward establishing indices for disease assessment, these do not take into consideration the patient's abdominal pain, nocturnal bowel movements, feelings of urgency, or the fear of episodes of incontinence, which are frequently their greatest concern. A review of the current consensus-based guidelines finds agreement that severity and extent of disease, in conjunction with patient preferences, are the cornerstones of initiating treatment. 5-ASA is the first-line treatment with the goal of inducing remission. These products act topically on the epithelial cells in the gut lumen to suppress the production of numerous pro-inflammatory mediators, cytokines, and neutralize reactive oxygen species. 5-ASA is primarily used to treat mild to moderate disease, which affects most of the individuals who suffer from ulcerative colitis. For patients whose symptoms flare while on a 5-ASA, oral steroid therapy is considered. Corticosteroids are potent anti-inflammatories that act on several inflammatory pathways. Once the acute attack is controlled, a maintenance regimen is considered for those with relapsing disease. The thiopurines are useful as steroid-sparing agents for steroid-dependent patients and for maintenance of remission not fully maintained by aminosalicylates alone. Patients suffering from severe colitis, refractory to maximal treatments with prednisone, aminosalicylates, and topical medications, may be responsive to therapy using monoclonal antibodies against tumor necrosis factor. Lastly, surgery should be considered for patients whose disease is not responding to intensive medical therapies. Ulcerative colitis is a lifelong disease that significantly impairs a patient's life. The goals of treatment as described in the ACG practice guidelines include induction and maintenance of remission in such a way that avoids long-term use of systemic corticosteroids, minimizes cancer risk, and improves the patient's quality of life. While inducing remission is the first step in achieving these treatment goals, It is becoming a moving target for the clinician. As the focus of effective management of UC shifts from symptom control to modifying the natural course of the disease, the lack of a standard accepted definition for remission is problematic. This confuses the clinician, both in clinical practice as well as in interpretation of various clinical efficacy studies. Without a common, agreed-upon therapeutic endpoint, remission rates are not comparable between studies. Mucosal healing may be a more objective endpoint than symptomatic remission for evaluating inflammatory bowel disease activity and may be valuable in both therapeutic trials and clinical practice. Intestinal healing is achieving prominence as a goal of therapy, and it has been suggested that physicians should be assessing the reduction of endoscopic activity with the intention of achieving complete mucosal healing as an indicator of remission. Traditionally, treatment success has been measured by improvement in and maintenance of symptomatic remission. However, recent evidence indicates that symptom remission alone isn't a reliable indicator of the clinical course of UC or the outcome of the disease. Data has pointed to a correlation between mucosal healing and some important factors that reflect on a patient's quality of life and prognosis: sustained remission rates, decreased disease-related complications such as colorectal cancer, and reduced healthcare utilization as a whole. Because endoscopy plays a pivotal role in the evaluation of disease activity, inter-observer variation is critical, since disagreement regarding disease severity can alter the proportion of patients defined as in remission and impact trial outcomes or treatment decisions. Recently, an objective index has been proposed to minimize the variability usually associated with endoscopic interpretation. The Ulcerative Colitis Endoscopic Index of Severity, or UCEIS, assesses changes in vascular pattern, bleeding, and ulceration to precisely define 3 to 4 levels of severity. While the UCEIS may provide a valuable tool in future clinical trials and patient care, repeat endoscopy is not frequently performed, as it is inconvenient and patients do not readily accept this method of assessment. As the therapeutic goals of UC have changed from mediation of symptoms towards modification of the natural history of the disease and preservation of gut function, standardized definitions and indices for disease severity, remission, and mucosal healing will need to be developed and incorporated into treatment guidelines. To conclude the educational exhibit, Ulcerative Colitis: Today's Issues and Options, keep these summary points in mind. Ulcerative colitis affects approximately 500,000 individuals in the United States, with direct medical costs estimated at more than $4 billion a year. Severity of disease is usually described as either mild, moderate, severe, or fulminant, based on several factors, including number of stools per day, whether blood is present, and whether the patient is exhibiting signs of toxicity. Pharmacologic therapy is applied in a sequential fashion based upon severity of disease or therapy failure at the previous level of treatment. Remission, the primary goal of therapy, can be assessed using clinical parameters and normal mucosa at endoscopy. Further studies are needed to establish a universal definition and indices for characterizing the various levels of disease severity, remission, and mucosal healing. Mucosal healing may prove to be a more efficient outcome measure for both clinical trials and long-term outcomes in UC patients. Thank you for taking the time to visit the Santaris Incorporated educational exhibit, Ulcerative Colitis: Today's Issues and Options.